For vaccinations for COVID-19, we know they're highly effective, but we don't yet know how long the protection is going to last for. So if we get vaccinated now, we'll be protected for a while. The studies have shown at least 3 months, at least 6 months. But beyond that, we're still not quite sure. Presumably the protection is going to last for some time. But one of the studies that I'm setting up now is to look for 4 or 5 years to see what's the level of protection in people who've been vaccinated, maybe after 3 or 4 years. Is it still a good level of protection of the antibody levels in the blood? And that's a marker in the blood of the kind of molecules that can help us to be protected against infection. What's their level? Has it come down a lot? Would we be well served by booster vaccinations, or can we wait a little bit longer? Because we don't want to give vaccinations if they're not necessary, but if people's immunity has come down after 3 or 4 years, then we'll probably recommend it's time to start having booster shots. Hopefully, by later this year, we'll have enough vaccine supply in Hong Kong that if everybody chose to get vaccinated, we could go back to normal. We would have herd immunity, by which I mean even if an infection comes into Hong Kong, it won't be able to spread because such a high proportion of the population are immune to infection. We have that for many childhood infections like measles, where even if there's an infection comes in, it just can't spread because we have such a high level of population immunity. So by later this year, we could be going back to normal. We wouldn't need to worry anymore about COVID-19. We wouldn't need school closures, workplace closures, bars, karaoke's, gyms closed, none of that. We wouldn't need the quarantine for 14 days or for 21 days because we wouldn't mind if infection comes into the city. But I'm not sure we're going to get there so soon because there's a lot of hesitancy about getting vaccination. So although we will have the vaccine supply, people may not choose to get vaccinated. And if that's the case, we're going to need to wait a little bit longer, and the government maybe is going to need to think of ways to persuade more and more people to get vaccinated, because until we get a high vaccine coverage, it won't be safe to return to normal. We could have periods of time when we relax the social distancing measures, but sooner or later the cases are going to come back, and we're going to have to bring back all those measures again, and that's going to go on for probably another 6 or 9 months. Maybe longer, depending on when the vaccine coverage comes up to that high level that we need. So we're aiming to stay at 0. Then if a vaccinated person goes out of Hong Kong to Australia and then wants to come back again, actually it's fine because there's no infections in Australia. They don't need to quarantine. It doesn't make any difference to Hong Kong because they're not going to bring infection back with them. But if that vaccinated person goes to Europe or goes to the US and then comes back again, there's a possibility they could be infected. By having the vaccination, their risk is much, much lower, but the vaccine is not 100% effective. It's like 95% effective for the BioNTech vaccine. So that's still a risk. And if there's a lot of people going to Europe and then coming back again, there's a risk that maybe 1 or 2 would be bringing the virus with them. And if all of those people are allowed back in without quarantine, there's a risk that then they'll spark some outbreaks in the community. And it's really, really disruptive to Hong Kong if there are outbreaks in the community. We've seen what happens. The government has to bring in all the social distancing measures, close a lot of things, workplaces. There's an economic impact. So most likely we won't allow people back into the city without quarantine with a vaccine passport until it's safe in Hong Kong to do so, until we have a high vaccine coverage locally. And then we don't mind. If we've got a high vaccine coverage with a high level of immunity, it doesn't matter anymore. We can let people in if they're infected, it's fine. They won't be able to transmit infection, we won't be able to have a large epidemic, and we can go back to normal.
I think that what we've seen through these clinical trials is that they have monitored people for asymptomatic virus carriage. So for the AstraZeneca vaccine, they actually swabbed people weekly that were vaccinated and tried to actually look for those cases, and they did see that vaccination dropped the asymptomatic virus carriage. It's still a possibility. And that's because the magnitude of your immune response needs to keep that in check. So these viruses do reduce transmission, which is what we're seeing now with widespread vaccination. So not only are you seeing lower hospitalization and deaths, you're also seeing that there is less cases in the community when there is widespread vaccination. And the first signal we got that was from the high coverage in the over 60-year-olds in Israel, that these vaccines are reducing transmission as well. But you need to look within that individual as to how much virus they're shedding. And that's something that they looked at in the AstraZeneca trial and could see that when they swabbed people, they found less virus as well. So they're quite promising to reduce the effects of this virus in the community. Viruses can continue to circulate despite widespread vaccination. And this is because we are a huge, diverse population. Our immune responses do wane and drop with time. So if you've been vaccinated recently, you're in a good position to be protected, but maybe in a year or two, your response has dropped below that protective threshold and you might become reinfected. And this is what we already see with endemic common cold coronaviruses, that they do reinfect us every 6 months to 2 years, but that's such a mild infection we don't normally seek medical help. So that's a common feature of coronaviruses. It's a common feature of influenza viruses, that we get reinfected maybe every 5 to 10 years because our immune response does drop. And viruses can circulate within humans. They can also cross over from animal reservoirs or from vector-borne sources. So viruses really are everywhere, and it's important to keep your immune response up to that protective level by getting revaccinated and maintaining a healthy lifestyle. So viruses are a consistent and persistent threat, and it's something that we can't drop our guard against. Just because you've had a vaccine once, you might need to get revaccinated. So we have tetanus boosters every 10 years, we have hepatitis B boosters every 10 years. There is some vaccines that are so effective, you get one shot and you're protected for your lifetime, but that's because that virus doesn't change. So for the yellow fever vaccine, which was developed in the 1930s, it's still the same vaccine that we're using now because that virus hasn't changed. Whereas SARS coronaviruses and influenza viruses continually change with time. And what we're seeing with these emerging variants for the SARS coronavirus is that can mean that some of those vaccines aren't as effective because they're based on that initial strain. So I think within the next few years we'll have to have some of those vaccines updated.